First, you should take a proper consent and exposure. Start from head to toe in examination. Patient with jaundice, then you should assess the GCS, mental function of the patient. Reason, due to the jaundice, there's a possibility of hepatic encephalopathy. One possibility of acute fulminant hepatic failure, which leads to a number of the complication, and the one complication is hepatic encephalopathy. Second point is, then you should assess the facial expression and the facial, any type of facial color. In case of anemia, the color of face will be pale, but in case of jaundice, that is yellowish discoloration of a skin. And then you assess the eyes by a sclera. नीचे पाँव की तरफ देखिए. So this is a deep jaundice, and conjunctiva will use for to assess the pale for anemia. So the patients having deep jaundice, which can be appreciated through a sclera as well as on the yellow discoloration of a facial skin. Then the next area to assess is abdominal examination. So she is a female patient, so we avoid to proper exposure, and and start without exposure. So the abdominal examination, for first is the liver, and the second thing is the spleen examination, and as well as ascites, shifting dullness and fluid thrill. Then we will assess the lower limb, any type of edema. The most common edema in patients with chronic disease is pitting edema, and this is due to hypoalbuminemia. And the next point of assessment is the hands. For hypoalbuminemia, features like a leukonychia or shining nail, as well as the palmar surface of hands. So in this patient, there is a yellowish discoloration of the arm as well as forearm and hands. So this is a case of a deep jaundice. What are the possibility with the deep jaundice? One, acute viral hepatitis. Okay, we will start with the investigation. First investigation is liver function test. In the liver function test, first is the bilirubin. Bilirubin, if increase, then we should divide into the direct and the indirect. The direct belongs to the liver disease, and the indirect indicate there is a extrahepatic involvement. So second, the important thing is the ALT. ALT shows hepatocytes damage. The third important test is biochemical marker is AST, which indicates there is some damage as well as there is some the fibrostic changes. And the next is alkaline phosphatase. What it indicates? Obstruction, intrahepatic cholestasis. And the next is GGT, and what it indicates? That indicates there is a changes in our biliary tract, or sometimes there is a inflammation or there is a obstruction. So we differentiate the raise in alkaline phosphatase from the other diseases. Alkaline phosphatase increase in other diseases like bone disorders, like a bone fracture. Second thing is intestinal diseases. Third, in case of the pregnancy, will increase. And the fourth, related to the liver disease. So the next investigation which differentiate this is due to the liver disease or from any other systemic disease is GGT. So GGT and alkaline phosphatase both increase, which indicate this is liver in origin. So next investigation, ultrasound abdomen to assess the liver ecotexture as well as total vein diameter, and there is a bile duct diameter. If the bile diameter enlarge, or there is obstruction, which indicate there is some intrahepatic cholestasis, which indicate there is a biliary channel disease. So what is the next investigation in case of intrahepatic cholestasis or raised alkaline phosphatase? MRCP. What is MRCP? Okay, and the other name is MRI liver. If MRI liver shows there is some obstruction, then what is the next investigation? Then you should assess the CT abdomen with contrast, or then you should assess the CT abdomen and the liver with protocol, and which indicate there is some extrahepatic lesions or the mass like a pancreatic mass which obstruct the biliary channel. Then we should go for the next to release the obstruction via ERCP. So what is the ERCP? Endoscopic cholangiopancreatography. So through ERCP we splenectomy as well as stenting. So this is the investigations protocol to assess or to proceed for the patients with a raised alkaline phosphatase as well as raised GGT. So other sportive investigations are blood CP to assess any inflammation. Then next is electrolytes, PT, APTT, INR, and the more important is the PT, which is associated with liver disease, and that indicate this is the which pathway, this is extrinsic or the intrinsic pathway. So this is associated with extrinsic pathway. The PT with extrinsic pathway you can remember with PET. So the PT with extrinsic pathway. And the next important investigations then to assess the electrolytes or renal profiles, to assess the any multi-organ disease associated with the acute fulminant hepatic failure or chronic liver disease. So this is all about how to assess the patients with obstructive jaundice or with deep jaundice in the absence of a viral hepatitis. Thank you very much. Proceed in a liver disease. In case of disturbance in the liver function test, bilirubin raised indicate there is some slowdown of a bile movements. So we can improve with the orthodeoxycholic acids. One. The second thing is ALT release due to hepatocyte damage or production of a free radicals. So we should treat with antioxidant. Third, alkaline phosphatase raised, then you should treat with the release of obstruction. The next important is, so this test is indicate the biochemical marker of the liver, and the second, the important test which indicate the liver synthetic function of the liver with albumin. Second thing is PT. So albumin and the PT indicate the synthetic function of the liver. So if these are disturbed, that means that there is some excessive derangement of a liver parenchyma or the liver's textural changes. So we improve the PT with the use of a vitamin K and albumin with the use of a sulfur albumin. What are the complications of a liver disease? One is the hypoglycemic events. Second thing is due to the hypoalbuminemia, which leads to a jaundice anasarca or anasarca, abdominal distension, ascites, or there is a edema. And the third is due to the deranged PT, which leads to the bleeding, from gum bleeding from the nasal bleeding or the GI bleeding. So treat these things according to the cause or with the different type of medications. PT with the vitamin K, albumin with the albumin, or liver function we have explained. Thank you very much.